In my practice, I am frequently asked by women who have just been diagnosed with breast cancer whether they should consider having genetic testing to see if there is an inherited genetic component to their occurrence of breast cancer. And it's a very good question. In my own practice, I routinely send people at elevated risk for a genetic cause of their breast cancer to a genetic counselor. I strongly believe that genetic counselors are a great resource for these people. Genetic counselors spend their entire day counseling people about whether they should consider having genetic testing, either why or why not, and then subsequent to that testing, they counsel patients about the consequences of being tested. So I am a firm believer in the use of genetic counselors in this setting. However, it's important for all of us to understand who is at increased risk for having a genetically determined breast cancer. So here are some of the risk factors that may point to you as a patient with breast cancer as somebody with elevated genetic risk, which may put you at increased risk for an additional breast cancer or may put your relatives at elevated risk for breast cancer. First of all, if you have breast cancer and you are younger than age 50 at the time of your diagnosis, you should be considered for genetic testing. People who are born with an inherited risk for breast cancer, people who are born with mutations that elevate their risk for breast cancer, are more likely to have that cancer occur at a younger age, in your 30s, in your 40s, sometimes even younger, although that's rare. Similarly, because breast cancer is primarily an illness that occurs in women as they age, breast cancers that occur simply because of the mutation one acquires over a lifetime are more likely to occur later, 50s, 60s, 70s. These rules are not hard and fast, and women with a genetically determined breast cancer certainly could present later, and the reverse is also true. However, that is a good starting point. So age younger than 50. Next, if you are a male and have breast cancer, you should be considered for genetic testing. Male breast cancer is rare. It represents about one breast cancer in 100. And the drivers of male breast cancer include a greater number of patients who are born with a genetic mutation predisposing them to breast cancer. So male breast cancer is a reason to undergo genetic testing. Next, if you have a particular type of breast cancer, which we refer to as triple negative breast cancer, you should be considered for genetic testing. Triple negative breast cancer is a shorthand for the kinds of breast cancer that have no estrogen receptors, no progesterone receptors, and do not have overexpression of the HER2 oncogene product. No estrogen receptors, no progesterone receptors, no overexpression of HER2. That is referred to as triple negative, and patients with triple negative breast cancer should be considered for genetic testing. Next, if you have the occurrence of more than a single breast cancer, you should be considered for genetic testing. For example, if you have a cancer in each of your breasts at the time of diagnosis, you should be considered for genetic testing. If you have two separate and distinct breast cancers in one breast, you should be considered for genetic testing. Or if you have had two occurrences of breast cancer in your lifetime, separated by years, you should be considered for genetic testing. Next, there is a group with Ashkenazi Jewish heritage who are at elevated risk for their breast cancers being driven by an inborn genetic mutation. If you have Ashkenazi Jewish heritage, you should be considered for genetic testing in the setting of your own breast cancer. And finally, there are elements of a person's family history which would drive the indication for genetic testing. And that is, if you have a family member who was younger than 50 at presentation of her or his breast cancer, you should be considered for testing. If you have a relative who had male breast cancer, you should be considered for genetic testing. If you have a relative with ovarian cancer and you have breast cancer, you should be considered for genetic testing. And the same is true for pancreatic cancer as well as certain types of prostate cancer. This is by no means the exhaustive list of reasons to consider genetic testing, but this is a very good starting point.